Well, I'm Senator Bob Casey. I want to start by thanking PA Families Need Nurses Now and Vision for Equality for inviting me to speak to you today. The COVID-19 pandemic expanded our understanding of the work done by and the stress placed on an overworked and underpaid healthcare workforce. It helped us to develop a renewed appreciation for the workers who support children, young people, and adults with disabilities and complex medical needs. The skilled home care nurses who provide services and supports to your children and families are essential workers, and we need to recognize their value. We entrust home care workers with the lives of our loved ones, but we support a system that does not justly compensate their work and their profession. Home health care workers provide skilled hospital-level care in the safety of the home and the community. These workers deserve not only the respect and gratitude for the frontline work that they performed during one of the greatest periods of crisis our nation faced in generations, they also deserve the compensation their peers in other parts of the healthcare industry enjoy. Older adults, children, and adults with disabilities and their families know the value of home and community-based services. Some refer to it as HCBS. They also know that the individuals who provide that care are so valuable. This is a time for home health care workers, the disability community, older adults, policymakers, and supporters of home and community-based services to come together to finally push for a permanent extension and expansion of these services and better pay for the people who are providing them. Access to home and community-based services can change the lives of millions of people, but it takes a dedicated workforce to achieve that kind of care. The dedication of the thousands of women, in particular women of color, who largely make up the home and community-based services workforce, are paid just $12 an hour. That's the national average, $12 an hour. That is unacceptable in America if we're going to call ourselves the greatest country in the world. So whether in the midst of a pandemic or part of an average day of care, this workforce is helping to keep people at home and part of the community. So we have an obligation to lift that workforce up, to pay them in accordance with the value we claim to place on their essential work. Whether a younger individual with a disability or an older adult, many of us will likely need access to some level of home and community-based services in our lives. HCBS can help individuals stay home and out of nursing homes and other congregate settings. Home and community-based services also allows individuals to access the healthcare and support services they need from the safety of their own homes. And home and community-based services also provides a lifeline to older family caregivers to receive support and to limit the need to take their family member to appointments outside the home. These services offer more than mere convenience. They are a lifeline for communities at risk of losing their independence. This option is not only cheaper for everyone involved, but more importantly, the benefits of being able to live in the community of one's choice result in better health outcomes, higher life satisfaction, and longer lifespans. Our nation needs a bold investment to strengthen home and community-based services and to strengthen the home and community-based services workforce and to better support the millions of people who rely on these vital services to live full and independent lives. I fought for an increase in HCBS funding from the start of the pandemic. And then later, once he was president, President Biden recognized the importance of home and community-based services funding through a $400 billion investment in the, or as part of, I should say, the American Jobs Plan. Now, this $400 billion investment builds on the nearly $12.7 billion investment in home and community-based services that was in the American Rescue Plan and that I fought to include. But we have a lot more to do. This funding that we just started to make part of our policy now with the Rescue Plan, this funding will make it possible for more people with disabilities and older adults to live in their own homes, participate in their own communities, to go to school, to hold a job, to receive the care that they need, and choose where they want to live. The American Jobs Plan recognizes home health and home care workers as a vital component of our nation's economy, and it seeks to adequately compensate and value this essential work. The President's proposal makes an investment in the caregiving economy in a manner unlike we've seen in many decades. We have a responsibility to advance transformative change and transformative solutions that allow individuals accessing home and community-based services and the workers who provide these services to not only survive, but to thrive. I think this is a mission worthy of a great country. But in order to get this done, we got to pass legislation. And we're a ways from that. We have to do a lot more work. I'd ask you and encourage you and really plead with you to engage your members of Congress, House members and senators. All of you here are passionate about this issue, but to advance permanent support for home and community-based services and to advance the urgent needs of that workforce, we will need to keep building support in Congress. So don't just contact them once, contact them multiple times, engage their staff, and probably most important, tell your story, or in some cases, more than one story. Tell those stories. They are the most persuasive testimony that will help us pass this needed investment, this long overdue investment in home and community-based services for our seniors, for our loved ones with disabilities, and in order to lift up the caregiving workforce. Thank you, and God bless your work.